Hello, all. My name is Rowan Gosi, and this is my pdsa model for Nurse 51, and I decided to do it on improving bedside reporting in the emergency room. The problem. So nurses in the pediatric ER where I work typically perform change of shift during in front of the computers. In doing this, there's a chance that important information is not passed on to the next shift. It also does not allow the patient and family to participate when change of shift occurs. Some bedside report research shows that literature supports the practice of bedside reporting as a means of improving quality care, patient satisfaction, and patient family participation in the plan of care. Additionally, evidence-based practice shows bedside reporting can increase communication and accountability between nurses, can improve communication between the nurse and the patient, improve coordination of patient care, and increase patient family adherence with the plan of care. And also, providing adequate information during change of shift reporting is essential to promoting patient safety. Under quality variance, the standard is, per the AHRQ, nurse shift changes require the successful transfer of information between nurses to prevent adverse events and medical errors. Communication during transition is important when it comes to ensuring that handoff is safe and effective. Bedside reporting can improve patient safety and quality patient experience of care, nursing staff satisfaction, time management, and accountability between nurses. Under evidence, which is what I've seen in my unit, I have observed that about 75% of the nurses are not compliant with bedside reporting. For the most part, I see nurses give report to each other in the nurses' station. Because of this, safety incidents have occurred, which include medication errors. Delays in care have also occurred, which would include late lab draws, late pending diagnostic tests, such as X-ray, CT, and ultrasound, meaning that the patients do not get to do their tests right away because it was not included during the report. Under root cause analysis, standardized reporting methods and improving methods of communication has been the goal of the Joint Commission. According to the Joint Commission, improved communication has been shown to improve patient care and satisfaction levels while decreasing the number of sentinel events reported by hospitals. Hospitals are moving to standardized reporting system using the Situation Background Assessment Recommendation Framework, which is SBAR, along with bedside reporting, where shift report is given in front of the patient. The literature shows that bedside reporting makes shift report more objective, concise, and relevant, thus financially beneficial as nurses are able to give report in a quicker time frame. In my unit, the supervisors and managers encourage bedside reporting. However, not every nurse is compliant. Recent incidents in the ER include incorrect infusion pump errors, such as fentanyl and heparin drips, which could have been corrected had the nurse given report at bedside and checked the infusion pump orders with each other. The current stakeholders for implementing bedside reporting would include nurses. Nurses are the ones responsible for implementing bedside shift reporting. Patients and family members are also stakeholders because they will be able to engage and participate during change of shift. This will also encourage patient safety and satisfaction as they're going to be involved in their care. Hospital administration would also be stakeholders due to the fact that efficient bedside reporting would mean less adverse events, which would result in increased patient satisfaction for the HCAPs of the hospital, and also potentially less finances caused by sentinel events. So the solution to this issue would be to implement bedside shift reporting in the unit. In doing this, less errors would occur and communication amongst nurses will improve. One of the ways to change nursing culture is to introduce different techniques to communicate patient-specific care at shift change. So this would mean bedside reporting along with SBAR. By reporting at the bedside in the presence of the patient, a culture shift can occur. The initiative would begin with educational sessions to reintroduce bedside shift reporting through a formal presentation and discussion. A standardized report sheet should be used to ensure that the report is concise and all pertinent information is covered. Families and patients will be allowed to participate during bedside reporting, which will lead to improved patient satisfaction. Under solution implementation, so the ED in my hospital has over 85 beds, in which there are 18 pediatric beds. According to Boschart et al., quality improvement projects include staggering implementation dates for each department and piloting the initiative in one or two departments before initiating it house-wide. So this would mean that SBAR and bedside reporting would start off in a smaller unit, and when it's successful and we can implement it successfully house-wide, it will be implemented in the whole entire ER. Implementing a bedside report will start off in the PEDS ER. That way, the department can fine-tune any barriers before implementing it in the whole hospital. And this would also allow feedback from nurses to make the necessary improvements as they are the ones implementing it. So over here I have just a typical SBAR, a simple, concise SBAR template in which the nurses can use to give report at bedside as well as document anything they may be missing for the patient. Under analysis, Boschart et al. Suggests a 60-day implementation phase to show support and guidance for the clinical nurses. Also, nurse surveys should be performed before implementation and after 3 months of implementation to gauge perceptions. So this would mean that it would be important to get a baseline of what the nurses feel about bedside reporting and how they feel after implementation in order to make the necessary changes. So it would also be effective to determine the baseline of patient satisfaction and also recheck after 3 months of implementation. Under ACT, the survey should be given to staff prior to implementation to achieve a baseline. Then, after 60 days, given to staff for comparison after implementation. With this survey, management will be able to gauge the effectiveness of SBAR and bedside reporting. The staff nurses have a voice to make changes so that bedside reporting is more effective. Management will be able to recognize those staff members effectively implementing the change. And if after 60 days of implementation that bedside reporting is not successful, management should consider revising the format. Over here is just like a simple bedside report survey based on a Likert scale, and this would be given to the staff in my unit and how they feel before implementing bedside report along with SBAR, and also given to them after in order to compare and see what changes need to be made regarding this new implementation. According to Cairns et al., these tables show the results of patient satisfaction before and after implementation. So because this involves patients and families as well, it is important that they are also satisfied with how we are doing change of shift report. So over here, as you can see, when it was implemented, the patients were highly satisfied, that they were very informed during change of shift report, and the nurses were very involved in their care as well. And then the bottom table shows the results of implementation before and after with the nurses and how they felt about giving report before and after. And that will conclude my presentation. Thank you.